so much for coming to join us in what will be, we're going to have an attempt to have a discussion. There's a lot of you here, so thank you for coming. So for those of you who have not had a chance to meet Secretary John Littell, this is John, and Secretary Littell, thanks for all you're doing. And I think one of the things that I've been so encouraged by is that from the very beginning of our administration, Secretary Littell and I decided that we were going to work with all of you and thousands of other people across the Commonwealth in order to transform our behavioral health system, because it needs it. It's overwhelmed, we know it. There is a crisis that has come out of this pandemic. And yes, there was a crisis before the pandemic, and a system that's completely overwhelmed. And therefore, we need to lock arms and get moving. And when we rolled out Right Help Right Now last December, we came together as a Commonwealth and made a commitment that we were going to build capacity, we were going to build workforce, we were going to include everybody, and we were going to get on a multi-year path to transform our behavioral health system. And so this discussion is a follow-on discussion to one that started in Stafford. And at the end of the discussion at Stafford, a number of people said, hey, we as faith community leaders have both aspirations, if not existing capabilities, and we want to be fully engaged. And sometimes we struggle to see how we are fully engaged. And I said, and John was sitting there with me, I said, well, let's go work on that. And so this is the follow-up to that exchange. And I can't tell you how excited I am for everyone to come and continue to work on this, because together we can make a big step. Let me share a little bit about who's here. And so first of all, as I said, John Littell is here, but also Martin Brown, our Chief Diversity Officer, is over here. So Martin. Our Health and Human Resources team is here. I mean, here strongly. And what do I mean by that? That's folks from social services. That's folks from behavioral health and developmental services. That's folks from medical assistance services. That's people from our Department of Health. That's people from our Department of Health professions. Every aspect of really, Mr. Secretary, your secretariat that steps in and impacts this whole ecosystem. On top of that, our Secretary of the Commonwealth, Kelly G, is here, and so thank you for coming. Thank you. And anyone who I've forgotten, I'm sorry, but there's a lot of folks here who are here to help us. So let me just do a little bit of table setting on why this discussion is so important. In addition to the reality of a system that is overwhelmed, we also have so many capabilities in the Commonwealth to support people who are having behavioral health challenges that have really been doing extraordinary work, but might not have felt completely involved in how these services can be supported by state government. But on top of that, we of course have faith leaders who are at the forefront of so many of the challenges. And one of the members of your congregation may feel so much more comfortable speaking to someone who is their faith leader as opposed to a counselor who they've never met before or may not know really what they have in common. And so the role that our faith community plays, all of our faith community, and I'm so excited that we have such an interfaith group here, is so important. And so what we wanted to try to do is set up all kinds of information resources so that we can move down this big spectrum. How do we equip the faith community with the knowledge and resources to be responsive to those who come to you in a moment of need? How do we make sure that, in fact, when that happens, that you have places to send people? And on top of that, for those of you that are building or have built services that already exist, how do we make sure that you're integrated into the broader delivery of services into mental health needs and substance use disorder needs. And so that is the whole goal here. What we're going to try to do is have a conversation, and let me just give you a sense. There's a lot of you here. We have folks from 70 houses of worship. We have 50 community leaders. We have nearly 50 nonprofit organizations that are here. And on top of that, there's about 50 staff members that are here as well in order to respond to questions and also help navigate what oftentimes, Mr. Secretary, is a tough system sometimes. And so there is a broad group of folks to participate today, and what I'm going to try to do with the Secretary's help is weave in all of those participants into a discussion. And so what I'd like to do is first involve, there's 5 folks who we've had previous discussions with that I think can seed this conversation because of some of the challenges, some of the progress, and some of the opportunities that you have already taken on. And then we'll open it up for comments and thoughts from the broader group. I'm going to work to try to get us done in this session by 10:30 because then there's a break. And then there's tables set up with all kinds of resources for folks to go have more directed one-on-one conversations about how do we navigate Medicaid? How do we reach into resources that can help us as members of the faith community bring resources maybe not at our house of worship for those who need help? All kinds, I think, of capabilities that are going to be here, and I hope everybody has a chance to participate in that. So, Mr. Secretary, before I get started, anything else you want to add to our introductory comments?
No, just to echo your welcome. It's a really great group. Thank you for being here today. And I also really, want to echo thanks to all the agency staff that are here. They really are here to help you. So there are all of the leaders as well as all the people who can make stuff happen are here at the tables. And so as we talk about things that are of interest to your faith community, they're there to help you with that. So
and I'll remind you at the end, but at the end, let's just make sure we point out where all of the tables are going to be set up and where these resources are going to be. All right, so let me just start. I've got 5 friends that I will call out to get us started, and then everybody please get your own questions ready, and we'll do our very, very best. And so I'm going to start with Corey Widmer. Corey is the lead pastor at Third Church RVA. Corey, there's a big bright light on my face, so I can't. There you are over here. Okay, super. And let me just give a little background on Corey's journey here, which he will share with us. Corey, your church, Third Church, has tragically suffered 3 suicides in the past 2 years. As a pastor, that has to be overwhelmingly grief-stricken. But on top of that, it does demand a response. And if you could just share with us the experience and what you've been doing at Third Church in order to really help people understand that there is help available and how to access it.
We've always struggled, had people struggling with mental health challenges, but obviously the last 2 years in seeing the spate of suicides has been truly overwhelming. It's really caused me as a pastor and our community to ask, how can the church become a safe place to talk about mental health challenges, and how could the church and faith communities in general become not just supportive communities, but even preventative communities? So two things that we've been working on. One is, first of all, just to cast a vision of the person as truly a whole person, body, mind, and spirit. Still in some Christian communities, there's a really strong separation between the body and the spirit. And there's so many Christians who think that if you have mental health challenges, or if you're struggling with depression or anxiety or suicidal ideation, then you're just not praying enough, or you're not believing hard enough. And there's even a suspicion towards classic, what are termed secular solutions to address some of the deepest challenges. And so one of the things we've sought to do is to try to cast a vision of the person that is a whole person, body, mind, and spirit, and that there's a whole battery of resources available that address not just the soul, but also the body, the brain, our physical and social personhood. The other thing I think we're trying to do is just be more open and become a more honest and transparent community. I myself have struggled with depression and anxiety for most of my life. So the more open I have been about that as a pastor, and the more we've invited other people through forums and classes to be transparent about mental health challenges, it has helped reduce the stigma within the congregation, and more people, I think, have felt more free and more safe to be able to name these things in their own lives. So it's certainly not, we haven't sort of solved it, but I think the crisis has caused us to take some meaningful steps.
Yeah.
Thanks.
Corey, thank you. Don't sit down quite yet, because we're gonna navigate this just a smidgen. What we all just heard was, first of all, creating a space to enable people to reach out, to not feel like they're alone. And that message is one we hear everywhere. You're not alone. We see you. We hear you. This isn't something that you need to hide. What a big step that is, particularly in the faith community, where everyone sitting in a house of worship might feel inhibited. And so, first of all, it's about leadership. So, thank you. What kinds of resources, either internal or external, are you trying to tap into in order to provide that next step when someone acknowledges, I need someone to speak with?
Well, we've created like many houses of worship, we've created a mental health team that includes a number of practitioners, mental health practitioners and other behavioral health leaders who attend our church or members of our church. And it's almost like a little triage unit, so that when someone comes to one of our leaders or someone comes to one of our pastors and explains a struggle that they're having, that person is able to reach out to our little team and be able to get some help of what's the best way to respond to that person, whether it's handling it in-house, whether it's through care and personal encouragement, or whether it's something that really requires something more serious, like a referral to a professional. So it's sort of created a structure for us to be able to refer people when we need to.
That's great. For those of you that are faith leaders, how many folks, just by showing of hand, have taken a step and created some sort of specialized team that folks can come find, and they may not be psychiatrists, but at least they can take a first step with? Really interesting. Very interesting first step, and so thank you.
I would just point out, your experience is not unique in the sense that even in the medical community, we still unfortunately separate physical health and mental health. And so a lot of places, we're really pushing hard to bring those things together. And so I think, one of the things that everyone can look at is you do have the opportunity to see people, sometimes in a more vulnerable situation, and a lot of physical issues are often just manifestations of a mental health issue. And so it's important to make sure, like when you're developing those teams, that you have the physical side of it, the health, as well as part of it.
Yeah, thank you. I believe will be a theme over the course of this time together, which is creating a safe environment for people to ask for help. In my own faith, we're called to ask for help, and yet it's one of the hardest things for people to do. And when we can invite people to ask for help and then give them a route to do it, then we can get the right help right now. And the team worked really hard on trying to understand that pathway. And so thank you, Corey. Let's see, Rabbi Asher, you're here. There you are. Hello. Great to see you again. So Rabbi Asher leads a very large congregation, very large synagogue here. I've been around for a long, long time. And one of the things that I know that you have spent a lot of your own personal energy on, but also the synagogue's energy on, is serving the community members with special needs, with intellectual and developmental challenges. Share with us a little bit about your efforts there and any real learnings that have been, I think, catalytic in changing the way you're serving a community that needs some support.
Thank you, Governor. Appreciate that. And just before I answer the question, just want to thank you for your support of the Jewish community during this difficult time. It's been very heartwarming to have that embrace from the governor's office and their mental health challenges that are actually related to that as well. Specific to the governor's question, is just in the last few weeks, there's a mother who hasn't been able to come to services, and she wants to be in communication with the Almighty. And she has 4 children, and 2 of them are autistic, and she's not able to be there, to be present in the sanctuary, to be with God and in communication with God at prayers, because we don't have the right facility to be able to accommodate her children. And I'm at a loss. I wasn't trained to be able to understand how to grapple with that. And she said, just for one example, one family, to create a sensory room or something that can be able to accommodate her children and their unique needs so that she's able to attend services, something that most of us in the Commonwealth take for granted, to go to services on a weekly basis. So I'm at a loss and lack of training and not aware of resources to be able to accomplish that. Another case that came up, the other case that I'll mention, is that because the Jewish community is so small, it's only 1% of the Central Virginia population, so Jews that are not a part of my immediate synagogue seek help and come to my door and have psychotic episodes or have issues that not able to deal with. And I'm just here this morning to learn from your team about what's available out there to be able to help those people. So thank you.
Thank you. Thank you. John?
I was just going to say, first off, for people who are in crisis, and we'll talk a lot, and you'll hear from the Commissioner of Behavioral Health about 988. So 988 is a new number that's been around for a couple of years and really being pushed. It's a mental health crisis line. And the mental health, they have access to specialized teams that provide support for children with special needs or adults with special needs, developmentally disabled who are in crisis. So if they're really in crisis or in need, that always is a number that is available to you and available to them. And they can deploy mobile crisis teams to the person's home or to their community or to the synagogue. And so that's really a tool that really has been ramped up, and I think will be a really useful one for us in the future.
John, is there the ability for members of a particular faith community to volunteer, be part of the 988 ecosystem? Absolutely.
So 988 is run in every state. In Virginia, we have been a real leader in that, and there are opportunities for people to be trained and to participate on those call centers, and so that's one of the things we'll talk about later as a volunteer opportunity.
Yeah, it's really important. 988 is, kind of battles with 911 as the number to call, and so many people appropriately call 911. It's fine, but if someone is truly contemplating self-harm, getting to 988 is such a direct path to a counterparty who can have a conversation and direct resources immediately. And so one of the things that we will recommend is that number is broadly disseminated in all of your communities, so people know where to call. John, there's something in the neighborhood of 8,000 calls a month that are going in Virginia, just in Virginia, 8,000 calls a month that are going to 988. And I'm so pleased with the response rates. We're at the top of the list nationally in no-drop calls and in pickup time. And in fact, I think our team's done such a good job. We're picking up call volume from other states. Of course, it's best when the local teams are dealing with local phone calls, because they'll be able to direct people to local resources. So that's big step number one. There's one other thing, Rabbi Asher, that I would highlight. There's an organization that's called REACH, REACH, and it stands for the Regional Education Assessment Crisis Service Habilitation. That's a lot. but you can find more out about REACH after the session. But REACH also works deeply with families that have members of their family who have intellectual or developmental disabilities to help for the exact circumstance you described. Also, there are resources around Virginia, which we should touch into, that provide respite for families that have family members, and particularly children, that they oftentimes never get a break. And, I mean, the 24/7 responsibility, and I'll just take a parent who has a child who requires around-the-clock care, is the most difficult from a relationship standpoint. Marriages fail. The family unit really suffers in an understandable way, because appropriate attention is being guided towards this family member that needs it. But there are also resources around the state, many of them faith-oriented, that provide weekend respite for families, so that they can have their child in a incredibly well-thought-through environment to provide the support system they need. And that's something that, of course, those resources will be described in a moment. As a pastor, or a synagogue leader, or an imam, I just so appreciate the fact that you used words, "I'm not trained for this." And I think that's a huge step for folks, which is, do I know what I don't know? And where do I go find help? And so thank you for the humility in that comment. Thank you very much. Okay. I'm going to move to a friend of mine, Valerie Coley. And Valerie's a pastor, but she's also a qualified mental health professional. Picking up on this topic of both the spiritual and the physiological side of health, the mind, the body, and the spirit. Can you just shed some light on your own experiences in trying to pull all those together?
Thank you for having me, Governor Youngkin, and you as well, Ms. Lindell. One of the things from the spiritual aspect and the physiological aspect, me personally have been an individual who've had to deal with both. I am one who had struggled with major depressive disorder. I'm also, as the governor said, I am a pastor, but I'm also a qualified mental health professional. And I experienced a lot, even with SUD, substance abuse disorder. And the challenges that I have ran into in my congregation, or just in the community as I brought someone from the community, is the lack of knowledge, the lack of understanding, as the rabbi said, And what I did was I put myself to the test, took my personal experiences, things that I went through spiritually and from the physical aspect and the mental aspect. I realized that there had to be a whole person. And the only way that I could become developmentally stronger is by obtaining the knowledge of what it is to become whole mentally, physically, and spiritually. That's what develops a whole person. And so while I'm at work and I deal with first episodes, right? Those are my clients. What I witness is that there's such a breakdown holistically, mentally, physically, and spiritually. A lot of times what the church looks at is they're demon possessed. That's not the case. There's a breakdown that comes from the lack of understanding, the lack of compassion, the lack of love, and the willingness to want to get knowledge of what an individual is actually dealing with so that there can be a whole person. The Bible tells us that our people perish from the lack of knowledge. And it's not that the knowledge is not presented. It's just that they reject it. And so when we're getting knowledge, make sure that not only that we get knowledge, but that we also get understanding of that which could help us and our families and our communities to become better in that area. Thank you.
Valerie, thank you. When I hear the consistent theme of the challenges of being a faith leader and being outside of a comfort zone without having the kinds of training that, Valerie, you have had in the other side of your professional life, it reminds us that we need to make sure that folks are getting prepared to deal with this consistent issue that is presenting itself all over. And Ms. Secretary, why don't you just share with folks the opportunity that we've uncovered with microgrants and the ability to help equip folks?
Great. Well, one of the things that we're going to announce today is that we're going to offer $800,000 in microgrants to faith communities and small nonprofits to allow you to build up some infrastructure or to do the education that's needed in your congregation. The grants will be up to $15,000, and we'll post a QR site later on where you can go and access that. But it's really intended, what we hear from you all is, this is really important. First thing is you need information, right? We need that sort of mental health program literacy that's out there, and that's one of the things why we have so many state employees here that can help with the services that we provide. But also thinking about how you can better equip your own congregation. So whether it's sending a team to do mental health training, mental health first aid, or suicide prevention programming, I think there's an opportunity to do that and to sort of seed that through Virginia and recognize how important you are to this process that we're doing and the unique opportunity that you have. And Valerie, when you're talking about that whole body experience, I think one of the things that we see, and many of you participate in this, is we see that particularly in the substance use area, right? People who are in recovery recognize the spiritual nature of their own recovery. It's why so many NA meetings and AA meetings are held in faith communities and things like that. So I think that's really important that we recognize all that. But the other thing that you started with is just the notion of mental health literacy, right? I mean, you'll recall when we got started in this conversation, how important it was just to help people understand where to go. And that's one of the reasons why 988 is such a useful tool. I'm sure many of you get a call of, I have a friend, I have a relative, I have a son or a daughter who's really struggling either with SUD, substance use, or with mental health, and no one knows where to go. If someone calls and says, I broke my leg, you say, go to the emergency room, and we're really, having a difficult time. So we'll talk later about the governor's plan, but part of that is to make sure that we have as many options available to people, and making sure that you know what those options are is really critical as we go forward. So these grants will be, we have to do it through sort of the state process, so it is sort of a bidding process, but I think many of you have applied for grants, and this should be a relatively easy one for us, and we'll get some really good, I hope, some best practices out in the community.
Great. So these grants are open to small nonprofits, yep, including the faith-based community. And where do people go to apply for them?
We're going to post a QR code, and it's through EVA, which is the state's procurement system, and it'll be through the Department of Behavioral Health. And we'll talk later. The commissioner can talk specifically about how to access those.
That's great. That's great. Recurring theme, and I try to find themes in all of these discussions, is training and support in order to create a knowledge and understanding within your own leadership that then can be passed on to your faith community. Hugely important. Okay, thank you, Valerie. Okay, so I'd next like to ask my friend Imam Sharif just a question about the Islamic community. And let me just begin with a word of thank you. For those of you that don't know Imam Sharif, not only is he a broader community leader, but he also serves as a chaplain in the fire department. And thank you for recognizing that our fire and rescue folks are on the front line, and that they consistently need prayer and support as well. And so thank you for that. So If you would, just share with us a bit of what you're seeing in your community particularly.
Well, thank you, Governor. Thank you very much for this event, and I thank everybody. I pray for everyone here and overseas. As you said, Governor, I'm blessed to serve in the fire department and the police department, besides as an imam of Islamic Center of Stafford. Actually, Stafford have the best program of chaplain. We have 9 chaplains. And we serve first our men and women in uniform, and we are there for them to assist them, and also because they go through a lot. And also we are there in a scene to make easy for them the job. Then we can actually, for the people who actually in Christ, that we are there for them too. Then I will share just one thing that happened Sunday. We get the call from 911 that detective needed a chaplain on the scene, and Sunday, we are 9 chaplain, but Sunday, I'm blessed to be the only one because everybody's in the church. Then I get all the calls. We need to work on something like that. Then I get the call from here to here, but I'm blessed. Then I go there and I find mother, she's crying, and the detective, they don't have time, they tell me, take care of her. And I go there and she told me that her son, he's been suffering for mental health for a long time. And I sit down with her, and she showed me her phone, and she said to me, he sent me a poem yesterday, and that was Saturday, and he told her, I want to see you today. And she said to him, well, listen, first of all, mental health can affect parents, affect economy, affect homeland security, affect everything. Then, first of all, the parent divorced very early because it was very hard for them. And the father came from Spotsylvania, the mother came from, I think, from North Virginia or something like, both of them living different. And this kid, he's not a kid, he's 32 years old. He texts her on Saturday and he tells her, Mom, I want to see you. She said to him, listen, we're going to watch the football tomorrow, Sunday, and we will wash your laundry. They gave him like a rental property, like a basement on a Pakistani family. The Pakistani family was there. They're crying more than the parents. And then on Sunday, she went to try to go to the basement to open the door. And he told her the day before, Saturday, give her a poem. Wrote a poem, and he said to her, why don't I, living, and why am I living? I want to suicide, why is not today? Then she said to him, listen, we will meet tomorrow. And she came Sunday, tried to open the door, and he overdosed, taking more, whatever. I don't know what happened. But his father came, and I sitting down with both of them. They told me the story for 30 years. They diagnosed him. It was very hard first to diagnose him in this country. I mean, it's very hard. And he's explaining to me how frustrated he is just to get him approved, from middle school. And he's now 32. And they told me how hard for them to deal together. And then they went separate, and they work with him for over the years until they find him a place with a beautiful family that they take care of him. And he was not able to work, and then they find him a job. And she feel guilty because she didn't go on Saturday. I'm hopeless, but at the same time, I'm there for them. They cannot believe that the fire department and the police have a chaplain for that, which is, thank God. And they tell me what's the process that they went through over the years and the challenge. And I'm not equipped, but God put me in this position, and I'm trained for the fire department and the police, but we are not trained to say what. We don't have a script to say for each condition. And as everybody say, we are trying to serve, but in the same time, we're emotion too. And we went through it, and we tell her we are there for you. But our relationship ended in the crime scene. We give her the business card for the fire department and we follow up with them. But we're not equipped to tell them because it's also paperwork and all stuff like that. This was the people in the county, and then we have was the fire department we have with the police department, and then with the Islamic center, like with the Muslim, it's a taboo. They don't want to say it outside loud because they're afraid of shame. A parent called me and he said to me, my son, he told me to put me in the basement because, lock the door because he's, substance abused. And we don't want to tell anybody. We want to make it secret. We're going to get him the medicine. But then in the end, they said, I'm going to go and buy him the pills. Then he just don't suffer anymore. And yes, we have numbers, but these numbers that we give them, they always go through like, is it diagnosed? They don't have the financial, because also I'm dealing also with a lot of refugees and a lot of, then I'm glad I'm here because I would get tools to take with me, but I have more than one hat, but I'm blessed and I'm learning one day and after a day, and thank you for inviting me. Thank you.
Thank you. Thank you. Sharif, thank you. John, one thing we should just think about is, literally, a little placard that folks can have of the most important places to go. One of the realities, and for those of you that have been on this journey with us, I came from outside government, and there are lots of programs and support. It's just hard to find. And I think one of the things we have so appreciated is the effort that everyone has made in order to try to find easy access to a support infrastructure to at least help people get started. And so I walk away from your comments with everybody just needs a simple access. Who do I call? Where do I go? And it doesn't necessarily need to be a state function, because there's lots of community, city and county functions as well. And of course, in the nonprofit and faith-based community. And so that's something that'd be interesting to work on with each one of you, and almost customizing it to each one of your congregations. Okay, John, anything you want to add there?
No, there are a lot of things that you said. One is just, and I think you all are addressing it, is just the stigma, right? In a lot of our communities, a lot of our families, a lot of our faith traditions, there's a stigma to talk about this. And I think it's great when you share your own personal side, whether it's, I don't know how to address this, to I've struggled with this as a person, to I've seen it in our faith, community. I think that's really important for people. I think one of the things when you sent us to work with the colleges early on, the Secretary of Education and I, and it made me feel really old. I thought I was young until I sat there with all these 20-year-olds who tell you every single thing about them. When you have kids who say that I've attempted suicide, I've considered suicide, I've taken this drug, for me, I could never say that aloud. And there's a different mindset, which I hope we can tap into in a very positive way to do that. But for us, it's hard to say, particularly if you're in a position of leadership, is to say, I've struggled with anxiety, I've struggled with depression. So I think that's really important. I do think, a lot of times dealing with substance use is a way for us to address other issues, but it's also important to recognize that the substance abuse is also sometimes a symptom of them not getting the care that they need it. And unfortunately, the substance use can lead to a quicker death than anything else, and particularly with the situation we're in today with fentanyl, where, a lot of people who are using drugs or not even know they're using drugs, will be exposed to fentanyl and will die. And so I think that, it makes us even more urgent to be on this. And so I think there are a lot of resources that are out there, but as the governor said, a lot of it is, and we need you to help us, is to say, how do we do this in the simplest way possible, and not say, you got to go to 16 different places to get the specific answer.
Agreed. Okay, let's see. John and Lacey Wagler, who are the lead pastors here at Hill City Church. John, where are you? I hope you're here. Oh, they're in the back. Perfect. So, John, I understand that your church is considering opening a counseling center. So beyond having a triage team, but actually opening up a center. Can you just share with us what that requires and some of the decision-making that you have gone through in order to arrive there, and what happens next?
Yeah, so we were in similar spaces as everyone else has been sharing in their own communities and seeing the wide range from, kids in elementary school having issues with mental health all the way up to seniors in our community. And overwhelmingly, we started seeing this idea of how people are so lonely and looking for hope. And so we got into this space of helping with our community. And two things really kind of became a centering point for how we started this. One was just off of an email that someone had shared with us, and that someone was going through some mental health issues, and he just signed the email, "Don't worry, we got him." And it was just this phrase that really stuck out to my wife, Lacey, of just, "We got him," and the heart to share with one another and to be there for one another. And then another question that my wife always asks is, for our community, is how do we help kill loneliness? And because it's such an epidemic. And so it led us down this conversation of what it would look like knowing that the system in and of itself is so overworked, and to get in, with a great counselor right now, you might have to wait 6 months to a year sometimes, and we just started thinking about, all right, as a community, how can we invest in our folks who want to get trained or licensed, and how can we financially invest in them and create some space? And then speaking with some of the health professionals in our community, they started sharing, well, what if we started a counseling center that was really designed, as has been talked about already, with kind of a whole body mindset, mind, body, soul, and what does it look like for us as a community to step into that space and develop a counseling center?
Fabulous. And so, John, just a few of the concerns that you might have had going into it and how you've addressed them, and what your timetable looks like.
Yeah, well, we actually just purchased this building, so and it's gonna take some time for that to develop. We have, in the beginning, one of the greatest concern was having the right people in the right spaces, and because a lot of the really good people are already taken, and so it was finding the really good people in our community that actually had a deep heart for it, that didn't know that this could be a space they could enter into. And so that was part of it that we're still navigating through. Obviously, just having the space to be able to do it and creating programs around that are the next steps for us right now.
That's great. Thank you. In our church, we actually started a counseling center a few years back, and as a church, there was, how do we run this? Do we have separate doors for people to go through? Is it open all the time when the church is closed? And the answer is yes. and it was amazing to see a counseling capability co-resident with the church, and yet have its own independentness, but on top of that, be available for congregation members and those outside of the congregation. And so, how many folks have had this happen in their house of worship, that they've started something that's actually a counseling center? So 1, 2, 3. I want you all your hands up just so folks can come find you. And the reason why is yes, they're here to help, but I think it's really important to see that. I mean, there's a blueprint here that you all could embrace. It's not easy, and oftentimes it takes a little bit of funding in order to get started, or to have a physical place to do this. And one of the things that is going to be available afterwards is, how do your counseling service centers get qualified in order to treat patients who then can be reimbursed through Medicaid. And John's going to tell me again that this is absolutely doable. You just have to go through a process. And there's somebody here from CMS, correct?
No, someone from our staff.
Somebody from health. I've got Cheryl right there.
We have health professions, we have Medicaid, we've got everybody who could help you wherever you are in that process.
And so really important, and I know that some of my friends have started counseling services and they're free. And they just said, just come and get help. And so thank you, John. Thank you for sharing that. And again, anybody who started one of these, please put your hand back up so that we can take a picture of you and people can come find you. So thank you. Thank you for that. Okay, let me do a little bit of wrapping up, and then I'd love to open it up for questions and comments and thoughts and observations from other folks. So thanks to all of you that allowed me and John to put you on the spot, but thank you for your great work that you are doing. And for folks that have other thoughts and comments, let's begin to, do we have microphones that we can, there's one here, there's one here, there's one back here, there's one here. Observations, challenges, questions, please, I'm going to open up. There's one back here in the back. And if you would, just identify yourself and tell us where you're from, and that'd be great, and then whatever you want to say.
Good morning. My name is Brittany Jones. My husband and I launched a church in 2017 on South Richmond called Motivation Church. Prior to us launching our church, I was diagnosed with bipolar, and I thought that would be the very thing that would disqualify me ever from doing anything great for the Lord. And I mean, I'm 37 years old. I have two beautiful girls at home, and I remember the season of my life not knowing what to do. And one of the greatest things was my own accessibility to therapy, and I started going to Footsteps counseling. My counselor's probably in this room, and it changed my life. And now I'm pursuing just helping people, not only in our community but around the world, find help, because I know the stigmas. I've felt it deeply. I also heard the comments, and I've experienced all of that, and I know the challenges. And I've had the privilege of having therapy, but I know there's people that grew up in the communities that I grew up in that did not have that. And so I think one of the greatest challenges we faced as a church early on, because we were only a 6-year-old church, is accessibility for people. I can tell people from the platform to go get therapy, to get all the help, but if I don't hand it to them and show them and lead them there, that was going to be the one thing that would keep them away. And financially, people just couldn't do it. And so during COVID, our church decided to pay for the first 3 sessions of anybody that was a part of our church to go to therapy. We partnered with 2 different counseling agencies. We partnered with Footsteps, and we partnered with Abundant Life Partners, and we just wanted to help people. And I think I just wanted to serve this as an encouragement to any pastors or leaders in this room that, part of our role is really helping give people hope. But I know the challenges of that, but I am a product of getting the help with therapy. And so when you talk about it, you're talking about it from a standpoint of this actually does offer people hope. And I have bipolar, but it does not have me. And so I'm walking in faith and hope. And so I just wanted to share that encouragement.
Thank you. Okay, we'll just bounce back and forth. Let's go over here. I saw somebody's hands up over here. Please, sir. Yes, here comes a microphone right to you.
Hi, I'm Alex Bechtold, and I'm from Petersburg, and the gentleman behind me is also from Petersburg, and I'm sure he's witnessed this too. I think a lot of what our discussion has been after someone's willing to accept or receive help, and we don't use this terminology, but I think everyone understands it. If you have some kind of street ministry and you interact with people directly who are in need, a lot of the people that we give a meal to or might pay for a hotel room for are clearly suffering from some form of mental or behavioral health crisis. And we really struggle to reach those people. We can clearly see that there's a common trajectory. And very unfortunately, I'm glad that they do receive the help, but very often we can tell already that it might be months or weeks before the police pick them up and they're involuntarily committed. And while I'm glad that that prevents them from hurting themselves, I wish there was a way that we could intervene when we can see the proverbial writing on the wall, but we can't encourage any change in their behavior. And
Thank you. Thank you. John, you want to comment on that?
Yeah, I think we're going to talk about the plan, and I think you're dead on. A lot of what we focus on in government is crisis services. And unfortunately in our system, the crisis system is designed to get people to a psychiatric hospital. And the reality is most people don't need to be in a psychiatric hospital, and psychiatric hospitals are not always the answer for a lot of individuals, and we just don't have enough space for everyone. So one of the focus areas has been to create more crisis service, more services pre-crisis and more services post-crisis. And post-crisis could include supportive housing, supportive employment, programs that we know. We know a lot of these people, like you say, you've seen them probably 10 times. They're going to, relapse. They're going to go into stuff. So making sure that we have those services, but getting more and more services into pre-crisis so that we can prevent things, we can get people, whether it's, mental health services or housing services or whatever it is, to do that. We're not going to be in a place where we're going to institutionalize all these people. So we have to make sure that we have services that are available to people, and right now there just aren't. And that's really what the governor's plan has been focused on, is pushing those services, fixing the crisis system, but pushing those services to pre-crisis.
Yeah. Thank you. Thank you. Okay, we'll go middle. All right, we'll go right here. Please, here we go. Yes. Here comes a microphone.
My name is Wynn Langford. I'm with Southside Church, and this is Cherie Knuckles with Footsteps Counseling. She's the director of the counseling center that we birthed 20 years ago. And a few of the questions that I would have is there a plan to offer possibly scholarships for nonprofit centers so that we could bridge the gap on high deductibles? That seems to be a barrier for people to get mental health services. And then also, what can we do to provide a leadership pipeline for our certified LCSWs to actually work with those that are in college to bill insurance for the services they see with good oversight, so that we can increase that pipeline of therapists, because getting good qualified therapists is a huge challenge. Our waiting lists are huge. And so those are two areas that would help us tremendously.
Great. Well, let me begin with one of the big steps that we accomplished earlier this year was passing legislation that mandated that commercial insurance cover mental health services. This was a big deal, and because it was something that was not always covered. And of course, as we've heard, the mind, body, and spirit are all one, and so that was a big step. The deductible idea is interesting, and let us think through that. I think there's, when it comes to Medicaid, John, and what is the next view on Medicaid coverage of behavioral health services?
Well, on the Medicaid side, we cover virtually everything. So that's, it does provide a lot of services. Medicaid is the largest provider of behavioral health services in Virginia, about $2.1 billion. So that covers a lot. But, when you talk about people with individual insurance, either there are limits or there is a deductible. So that we'll look into that more. On the pipeline, that has been a huge focus of the governor, and looking at all across the board in healthcare, but specifically in behavioral health. So looking at, how do we create that career path to get as many people in early as we can? And we're looking at some options to sort of increase the number of people coming in. And I'll just say, even something as simple, in every single college, psychology is like the first, second, or third biggest major. And yet the number of people coming out of college going into any kind of behavioral health service who are psychology majors is really low. So we've been looking at why are they not doing that? Is it the cost? Is it getting a master's degree or getting, certified or getting a license? What does that do? But our job, and I would encourage everyone, is we need more people in the pipeline. And so, one of the things the governor is asking all of the high schools, wants everyone who graduates from high school to not only have a high school diploma, but also a certificate. And so one of the things we're looking at is there sort of a behavioral health certificate where we could get kids early on in high school to be interested in this. The Department of Behavioral Health does a similar program at Central State Hospital, so can we build off those experiences? So I think that is our job. We don't have all the answers, so we certainly welcome your perspective as well, but that is going to, help us for the next 10 years if we don't really focus on that.
Yeah, and we've got a learning curve on so many of these critical categories of workforce shortage, and we're beginning to see a number of what I might call breakthrough ideas in the nursing field. How do we allow the nursing profession to earn while they learn? And so we can go to work right away. And that exact same model transfers across so many of these most important professions that we know we need qualified people in, but the pathway there has really, for whatever reason, inhibited the kinds of supply that we need. And so I am a big advocate of earning while they learn, and having, of course, appropriate oversight. And that is also a way they learn, which is to be mentored as they are engaged in learning while they have a chance to earn some money along the way. So,
Governor, we have a question. One more question for you.
Oh, thank you. I'm Jay Kansara. I'm here representing the BAPS Swaminarayan community, which has 6 Hindu temples in Virginia as well as 100 across the country. And our spiritual leader really prioritized de-addiction campaigns, so he's healed tens of thousands of people across the world from addiction. But as drugs become more technologically advanced, so do our responses. So I wanted to ask, particularly to the Secretary, how are we applying predictive analytics and other, computer-based modeling to predict addiction and also apply those to faith-based houses to be able to provide resources to prevent addiction as well as see trends in our communities?
That's a great question, and I am actually going to defer that later on to my panel of doctors who are here. But I do know, when we think about, that's one of the things where having private sector partners, and for us in Medicaid, having the managed care organizations that have really engaged in predictive analytics and predictive modeling, I think can be really helpful. We also are learning more and more about genes and particularly people's predisposition to things. So I think, we're at this stage where technology can really help us. Unfortunately, from a state's perspective, the state is usually a follower in that, because of just the nature of how long it takes us to get stuff out. And so, part of it is to really encourage our research institutions like, VCU and UVA and Tech and things like that, to really focus on these things. So I think we can talk about that later in our panel as well, but that's a really good point, and particularly with the lethality of the drugs that we're dealing with today.
So 2 things just to add. First of all, just on the overdose law enforcement side of things, we are now able to develop almost a real-time heat map of overdose hotspots and react quickly to that. That is not predictive, that is reactionary, but at least we're gathering the data to be able to do this. And we can see areas where there truly are concentrated overdoses. The second is really helpful because I issued an executive order recently on artificial intelligence. And my executive order was crafted in a way for us to run towards the tremendous opportunities that artificial intelligence provides, but also for us to be very aware of the privacy risks and also the biases that can exist in artificial intelligence that we need to protect ourselves from, guardrails, if not immediate red button stops. What we are working through is the applications of artificial intelligence that can fundamentally step function our understanding of really hard to tackle challenges. We're going to eventually, my goal is for us to begin to run pilots. I believe pilots are really important for us to not sit around in rooms and have committee meetings, but to find ways to direct and go. And so one of these might be really interesting to do in this area of addiction and overdoses. And so we were sitting around yesterday truly debating areas for pilots, education, law enforcement, et cetera. But this is a good one. And so thank you for your comment. Thank you. I'm watching our time, and I know there's lots of other questions that folks have and comments. The session's not ending. We're going to take a break. Share a little bit more about Right Help right now, just so everybody understands where we're going. But that also, there's just some real takeaways from this discussion that I want to emphasize for folks. So last December, when we rolled out what was almost a year's worth of work on Right Help right now to transform our behavioral health system, both mental health and substance use disorder system, the aspiration was not to tweak things. The aspiration was to transform it. And the recognition that the whole system was being overwhelmed because it was designed for a different era and for a completely different volume. And therefore we needed to step back. And what Secretary Littell mentioned is so important to recognize that the system was designed for in-crisis moments. And the reality, of course, is that what we've talked about today is that if we can find ways to address pre-crisis moments so we can prevent the in-crisis moment, then the whole system will be far much more effective. And therefore, we need to build capacity across the whole system. Pre-crisis, 988, far more counselors, workforce, partnering with the faith-based community and nonprofits, and making sure that we are using all of the pre-crisis resources that we possibly can find together. And it is not a government-only moment, because if it is, we will not get there. And we need you. We need you engaged in this. We need you to access training. We need you to access support systems. We need you to share resources. And so if there's a wonderful counseling center that's available around the corner, you may not need one, but you just need to know it's there so that you can refer members of your congregation there. But also we need to change the way we're thinking about in crisis. And part of that is recognizing that a hospital emergency department in law enforcement custody is most likely the wrong place to be. And therefore, if we can build mobile crisis units, we can build crisis receiving centers. Yes, we need psychiatric emergency departments, and we've had 2 ribbon cuttings in the last month that have been amazing. We know we need to change the customer journey when they're in crisis. And then, of course, post-crisis requires so much more attention, because if we don't handle post-crisis correctly, all we're going to do is see a repeat journey back into crisis. And so this is a holistic approach that, in fact, can't be done in 1 month or even 1 year. We have a 3-year timeline, with year 1 being a massive step in creating capacity in the system. And then step 2 will be another big step of capacity in workforce, because so many of the things we're doing now are to develop workforce won't translate until we see those folks come out in step 2. And then step 3 is to do all the things that we need to do that we don't know we need to do. And that is because we think we have this directionally correct, but we learn every day that there's a new approach or a new idea or something that's working here that we need to do more of. So that is Right Help right now. To recognize that when someone needs help, they don't need it in a month or 2 months. They need to speak to someone now. And that is all of us together recognizing that truth. That if we can help someone now, they may never go into crisis. And if they don't ever go into crisis, think about that one life and how it will be changed. So that's why we've so enjoyed this engagement. Secretary Littell, thank you for your leadership and for the whole team. What I've heard today are reaffirming and also great lights of hope in approaches And I just want to, if anybody's keeping notes, a few things that I found as great reminders, but also maybe beacons of places to work towards. First is the recognition that in our houses of worship, you meet people at a moment where they are going to trust you. They are at a moment where they are seeking. And that is an extraordinary opportunity for us to meet them where they are. And so we're asking folks to equip yourself. Understand what's available. Get training. Understand how your congregations can volunteer and be engaged. So a reminder, there's $800,000 of micro-grants that are being made available for small nonprofits in the faith-based community. Please apply. Please apply. Second of all, there are some really, really great ideas of having mental health and behavioral health triage teams that can go to work immediately and at least be a first step. And then, of course, there's information that can be handed to all congregation members, 988 being at the top of the list. The second thing that we've heard a lot about, and I think in this conversation, is destigmatizing the need to ask for help. And when we destigmatize it, and I love the word that sometimes it's taboo, we have to open up an avenue. And so your ability as leaders to speak into this in a compassionate way and share your own stories, or others who are willing to share their stories, is opening a door. And we've heard that from lots of folks across all faiths, and so thank you for that. There is a real push to develop centers, and we've seen some great initiatives, some of them decades old, and so thank you, and others brand new. You don't have to come up with the formula on your own. I find copying other successes to be the fastest way to get someplace. And so I will happily borrow other people's ideas. But I ask people to raise their hands on purpose, and over the course of the discussion for the rest of the day, if you believe that your house of worship has the opportunity to do something and you're looking for some guidance on best practices, please go find them. And then finally, and it's a way I'd like to close, is just to pray. You know, in each one of our faiths, we're called to prayer. We're called to prayer because it is the moment where we ask for help. We acknowledge thankfulness and we ask for help. And so that's the way I'd like for us to close this session if we can. And I believe my friend Calvin Duncan is here somewhere.
He's sick.
Oh, Calvin's not feeling well today. Okay, well then I'm going to close this in prayer, which is something I very much enjoy doing. And then we have a break, and then we'll pick up with what's next.
We have I'm going to do a quick overview of the Right Help Right Now plan and how it affects you all, and then we have a panel with the head of Medicaid and the head of social services and the head of behavioral health, and we'll talk about some specific programs for you, and we'll learn more about the $800,000 as well.
That's great. And if people want to ask questions of our tables, when is that? That's open all the time?
They're open all the time, and we're going to stay through lunch, and all those people will be there to help you with your answers. And then after this, we have 3 follow-up virtual calls where we'll talk about some specific things. And we know that a lot of you all are the leaders, and like good leaders, you're going to go back and hand this assignment to someone else in your congregation, and we want to make sure that they have access to some of the things that we talk about on these calls.
That's great. That's great. Okay. If we can let's just center ourselves and catch our breath and slow down and give us a chance to talk to the Almighty. Father, we come together today representing many different people. We come together with different professions. We come together as faith leaders. We come together as public servants. We come together as a group of people who want to make a difference in people's lives who need help. And so we just ask for your help. Father, I continually feel so blessed in the morning when I am able to pray to you. Where does my help come from? It comes from the Lord, maker of heaven and earth. So Father, we ask for help. Inspire us on pathways to tap into all of the capabilities that exist. Inspire us to try new things. Inspire us to meet people where they are, which is where you meet us. And most importantly, Father, I just ask for your blessing over everyone in this room, that they may do your will. And we pray all this in your mighty name. Amen. 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 Thank you all very